Hi, my name is Kenyatta Dixon. I'm an Auburn University MSN student in the Family Practitioner Program. Today I will be discussing viral upper respiratory infection. This is fall semester 2017. Viral upper respiratory infections are the most common infectious disease encountered. They account for millions of visits to healthcare providers annually. It is defined as an infection of the upper respiratory tract that is caused by a virus. There are many common names that the viral upper respiratory have, and they are known as a common cold, rhinosinusitis, nasopharyngitis, and upper respiratory illness. Risk factors are not everyone exposed to or coming direct contact with an ill person will catch the virus. People are especially prone if there is a decrease in the body's immune system so that the virus can begin to spread within the body and cause symptoms in the body. The exposure to infected individuals by inhaling viral droplets due to coughing and sneezing. Also, psychological stressors, touching of contaminated surface, and that is followed by touching your nose or eye, the conjunctiva of your eye. For infants and children, they are most inclined due to immature immune systems that is not able to fight the virus as well as it is in adults. Three key questions. When did the symptoms first start? By answering this question, it helps you to determine whether it is a viral infection because the duration of a viral infection is 3 to 10 days usually. Next question is there anyone at home, school, work, or daycare that is ill? By asking whether the patient has been around other ill people will help to increase the likelihood that they may have contracted a viral or bacterial infection. Also, the third and final question you would ask is, what symptoms are you having? By asking what symptoms are you having, it will help with the assessment that you're going to perform on a patient and also help with the diagnosis of the patient. Also, you would do a physical examination would really focus on the head, neck, and lungs. When doing the head examination, you examine the ears first, which may reveal fluid behind the eardrums, suggesting a stationary tube swelling due to the virus. Also, you're doing nasal examination, which may show clear drainage or discharge, and next you'll move to the throat, which may reveal some redness and postnasal drainage. Also, you examine the neck by palpating to feel for swollen lymph nodes, which is associated with virus and infections and bacteria infections. The lungs will be assessed with a stethoscope by listening to the lungs to see whether or not there's any wheezing or crackling sounds, both signs of inflammation or infection. The treatment is directed at managing symptoms while the body's own immune system fights the infection. The most common treatment for a viral upper respiratory illness is generally treating to relieve symptoms. You can recommend over-the-counter medications such as antihistamines or oral decongestants. They help with to dry nasal secretions or help to increase help with the mucous membranes to improve ventilation. Also, you want to encourage the patient to rest because rest heals the body. Also, to drink plenty of fluids to prevent dehydration, and also it helps with moisturizing the sinus and nose membranes. Also, you want to encourage the patients to increase their fluids with things such as chicken soup, tea, or warm apple juice. Also, you want to recommend an air humidifier. A cool mist is a better option, and this will help keep the air moist as well as the nose and sinus membranes. Also, the teaching components include avoiding people that are ill, avoid touching your nose, eyes, mouth with unwashed hands, cover your cough and sneeze. Sneezes and coughs should be covered with the elbow or sleeve, not the hand. And most importantly, wash your hands often and properly. 20 seconds or more with soap and warm water is indicated for proper hand washing. Again, my name is Kenyatta Dixon, and I have done viral upper respiratory infection for you.